as a mental health professional, how would you define or what are the things that you want to convey about stress to the general audience?
Stress is a physical and psychological response to a external stressor, which is exceeding our ability to cope. Right? When the situational demands is exceeding our ability to cope up with it, we will call it as a stress. And then basically there are two types of stress. One is eustress and another one is distress. And eustress is more positive in aspects.
Positive stress?
Yeah, like we will prepare for exam because we are not that much confident like we will pass the exam. Like that time we will have that one kind of stress. Because of that stress we will perform well, we will prepare ourselves. Right? The stress during the exam time we can call it as eustress, which will motivate. It will motivate us to do things, and it will give some motivations actually. But when it comes to distress, it actually harms us.
It is a bad stress.
Yes, bad stress.
Now that you have defined stress and you have spoken about two types of stresses, what I have to ask you is, what exactly is the brain mechanism behind stress? How does it affect our body? Is there any connection between the mind and body? So that is the question.
Yeah, like we already know, the mind is connected with our body. Similarly, the stress have influence on our brain, and the brain have influence on stress also. Basically, two mechanisms we can explain. One is you heard about nervous systems?
Yeah, nervous system.
Basically, nervous system is divided into central nervous system and peripheral nervous system. And then in peripheral nervous system again divided into somatic nervous system and autonomic nervous system. And this autonomic nervous system have another division called sympathetic and parasympathetic. This have an influence. I think you heard about flight or fight response. Adrenaline, noradrenaline.
Yes.
It is done by these mechanisms, like somatic, this sympathetic nervous system. Like it will activate certain aspect, like it will dilate our pupils and then increase our blood flow. It will reduce our reproduction rate. Like that, it will control our reproduction mechanisms, and then some certain changes will happen. Physiological changes is happen. And then stress will influence this nervous system. In second way, it is controlled by HPA axis. Hypothalamus, pituitary gland and adrenal gland. And then whole together they secrete certain hormones. Have you heard about cortisol?
Yeah, the stress hormone. Yes.
Similarly, there is some other hormones called corticotropin, adrenocorticotropin hormones. It have a very bad effect on our body. Actually, it will influence our cardiovascular system. It influence our gut or gastrointestinal functions, immune system, and it will change according to it, and then it will eventually lead to some serious consequences, like probably hypertension, right? And then increased flow of blood lead to another cardiovascular problems. Like that, it affect our body by particularly by these two mechanisms. Right.
Okay.